Welcome back to the What's in Your Head podcast, where we talk about pain and dizziness not being all in your head, but being the result of how your brain, body, and nervous system work together. Today, we're going to talk about something that actually is in your head, your autonomic nervous system. The autonomic nervous system is the part of your nervous system that constantly decides one basic question: am I safe or is my life in danger? When that system gets stuck acting like you're in danger, even when it's not, pain hurts more, dizziness feels worse, and recovery slows down. In today's episode, we'll break down how the autonomic nervous system works, what fight or flight really means, the role of the vagus nerve, how heart rate variability fits in, and why things like concussion recovery, stress, and chronic pain can trap your body in survival mode. And just like always, I'll give you some simple tools you can start using today to help your nervous system feel safe. So let's get started. Picture this. You're walking through the woods and suddenly a bear jumps out at you. In that moment, you don't think, you don't analyze, your body instantly switches in survival mode. At this moment, your nervous system has one important job: to keep you alive. So let's discuss how this works. So the nervous system is made up of your brain, spinal cord, and then you have all these nerves that come out of your brain and all these nerves that come out of your spinal cord. There's 12 cranial nerves that come out of your brain and 31 spinal nerves that come out of the spinal cord. There's 86 billion neurons in your nervous system, so it's a very intricate system. You have your vagus nerve, which a lot of times when people talk about autonomic dysregulation, they talk about the vagus nerve. And the vagus nerve is your 10th cranial nerve, so it's one of the nerves that come off of your brain. Now, the autonomic nervous system, this is the area in your brainstem. So the autonomic nervous system sounds like automatic because it controls the automatic functions of your body. It controls your heart. It controls your lungs. It controls your digestive system, urinary system, reproductive system, immune system. It controls all the automatic functions in your body. You don't have to tell your heart to beat. You don't have to tell your lungs to breathe. It's working all the time, and it's involuntary. You could have some effect on it, but this is your autopilot for your body. The different parts of the autonomic nervous system, we have the brainstem. So the brainstem, where there's structures in the brainstem like the medulla and the pons, and this area is the main control hub of your autonomic nervous system, or of the body. It controls heart rate, blood pressure, breathing rhythm, digestive system, urinary system function. This is the survival part of your brain. It runs whether you're awake, you're asleep, you're unconscious. It's always on, always running. If the brainstem thinks you're in danger, then it turns on survival mode automatically. Then there are other areas in the autonomic nervous system, like the hypothalamus. So the hypothalamus controls hormones like cortisol and adrenaline. It helps regulate temperature and hunger. You have your amygdala, which the amygdala is like your reptilian or primitive brain that detects threat, like using trauma and past experiences to determine if you're in danger. And usually sometimes if the amygdala is hypersensitive, that happens a lot in chronic pain, concussion, trauma, migraine. This area keeps firing and thinking that you're in danger, even if you're actually safe. Then the area in your brain that's your decision maker is your prefrontal cortex. So the prefrontal cortex is like the brake. That's in charge of executive function, decision making, and it's the part of the brain that will actually determine if you're safe or if you're in danger. So the prefrontal cortex actually is making that decision. Just like in our previous episodes, the prefrontal cortex is determining if the body needs to protect you, if you're safe or you're in danger. So now there's two branches of the autonomic nervous system. You have your sympathetic branch and you have your parasympathetic branch. Now the sympathetic branch we call fight or flight, which I think a lot of people have heard of. So sympathetic branch is called fight or flight. And then on the other side, you have your parasympathetic branch, which we call rest and digest or rest and repair. And I like to think of it like a dial. So if you start in the middle's pretty neutral. If that dial goes over to the left, you're in the sympathetic branch of the autonomic nervous system and you're in fight or flight. And then that dial, picture a dial going to the right. If it goes all the way to the right, that's your parasympathetic branch that we call rest and digest or rest and repair. Okay? So let's go back to the story of the bear in the woods. So you're walking down the woods, you're going on a hike, it's a nice day, and all of a sudden a bear jumps out at you. So what happens when the bear jumps out at you? So walking down the woods, everything's going well. Bear jumps out. All of a sudden you get a rush of adrenaline, right? So get a rush of adrenaline and cortisol. Your pupils dilate. All of your body resources go to the large muscle groups like your arms and your legs, and your pupils are dilated. So you're super focused and you're super strong and you're super fast. And that's a sympathetic response that we call fight or flight. So you're walking in the woods, bear jumps out, you go into fight or flight. So you get a rush of adrenaline, your pupils dilate, all the blood flow and body's resources go to the large muscle groups in your arms and legs and core, and you get super focused. So you're really strong, you're really fast, you're really focused. Your heart rate shoots up, breathing becomes fast and shallow, your pupils dilate, to take in more visual information. Blood is sent to these large muscle groups. Blood is shunted away from digestion, immune system, and healing. Your muscle tension increases and your sweating increases. So the body's using all available resources to be safe and escape from danger. So this is what we call fight or flight or survival mode. You're really strong, you're really fast, you're really focused, and in that case, you have a better chance of surviving a bear attack in this situation. It also makes me think about the story where the mom runs over her baby. I guess pretty dark story, but I feel like you always kind of hear this story where a mom runs over her baby and then she runs out of the car and then goes in the back and could lift the car for a split second because she has all this adrenaline. So I think of that. I don't know how true that story is, but that story makes sense. It speaks to fight or flight and the sympathetic. So that mom in that moment, an emergency happened, life was in danger, life was threatened. She runs out of the car. She's super focused. She's super strong, super fast. She has all this adrenaline. All of her body's resources are in her large muscle groups and in her focus. And in that moment, she could lift up the car and then pull the baby out, and the baby's safe. So hopefully in that story, the baby was safe. But I like to think about that story also when I'm describing the autonomic nervous system and the fight or flight system. So we already know how survival mode, or how the sympathetic branch of the autonomic nervous system affects the body, right? So we could measure these things. So I like to use biofeedback in my clinic, or there might be some wearable devices that people use, and we could measure heart rate, and we could measure breathing rate, and we could measure hand temperature, and we could measure sweating on the hands and muscle tension and blood flow and brain waves. So it's pretty cool that we have the technology to measure if someone is in fight or flight, or someone is in the rest and digest parasympathetic system also. So for this, we use, there's a bunch of different biofeedback devices that we could use. So that being said, survival mode sympathetic nervous system, fight or flight, all the same thing. And it's not necessarily a bad thing, right? It's not necessarily a bad thing to be in fight or flight. Fight or flight is good if you're in danger. It's good if you're playing sport. It's good if you're getting ready to do a presentation at work. It makes you more focused. It could make you perform better. But what happens if the survival mode or fight or flight stays on for too long? That's when we start to run into issues. So basically, if you're stuck in fight or flight, so think of it as a gauge or a dial. It's not like you're in fight or flight or you're in rest and digest, one or the other. It's levels. Obviously, the bear jumping out at you in the woods or someone attacking you, you're going to be at a higher level. There's going to be a bigger adrenaline rush. You're going to have more of a sympathetic response. And if there's just a little bit of danger, you have a smaller response. Think of it like a gauge and not necessarily an on-off switch. Oh, say you're stressed out and you're having a bad day and you're not getting along with your partner and you didn't sleep well that night and you don't like your job. So in that case, you're not in full fight or flight, but you're a little bit in that sympathetic system. So we call that you have some increased sympathetic tone. So when the sympathetic nervous system or fight or flight is on for too long and you're stuck in this system, your body thinks you're in danger. So all the body's resources are going towards your focus and your large muscle groups, and they're preparing you for activity, or they're mobilizing you to get ready for battle. So in that sense, you're not getting all the resources to your digestive system. Pain becomes louder or more painful. Dizziness becomes easier to trigger. Your sleep worsens. Your recovery slows. You may have to urinate more frequently. You may have diarrhea. Or you might be constipated. You might get sick all the time. So basically, your body's not getting all the resources that it needs. And because the brain and the autonomic nervous system feels more threatened or feels more in danger. So the key message here is your body isn't broken. Your body thinks you're in danger, so you're experiencing all these symptoms. So often when I explain this to my clients, or I'm explaining this to people, and I'm saying that, hey, when you're in fight or flight for too long and your digestive system, urinary system, immune system, and all your involuntary systems aren't getting the resources, you might have to pee all the time. You might have diarrhea. You might be constipated. You might not sleep well. Then it usually someone who is dysregulated is having those symptoms, and they could relate to those symptoms. These are the people who maybe on all the diagnostic tests, everything is showing up normal, but you still don't feel right. So you could be dysregulated. And it's cool that we have ways to measure this. And we also have things to do to treat it. And now the metric we use to measure this is called heart rate variability. So heart rate variability is interesting. That's the measurement that's used on the Oura Ring or on the Whoop or on Apple Health or the Garmin. So all these devices, these wearable devices that use this metric to tell you how stressed you are or how well you slept at night, they use heart rate variability. So now what heart rate variability is, there's something called sinus arrhythmia in your body. So when you breathe in, so if I take your pulse, if you take your pulse and it's 70 beats per minute, which is a pretty normal pulse. So resting pulse is 70 beats per minute. It's not uniform. When you breathe in, your pulse actually is faster. And then when you breathe out, your pulse is actually slower. So breathing in increases the frequency of the beats and breathing out decreases the frequency of the beats. And that's called sinus arrhythmia, and that's normal. So what heart rate variability is, it looks at how fast the beats speed up when you breathe in and how slow the beats slow down when you breathe out. And that is called, the difference between the two is called heart rate variability. So again, inhale speeds up your heart rate and exhale slows down your heart rate. So I like to think of inhalation is more of a sympathetic activity and exhalation is more of a parasympathetic or a rest and digest activity. So inhalation is more mobilizes you, wakes you up. Exhalation is going to relax you and get you into that parasympathetic system. So with heart rate variability, it's interesting because the higher your heart rate variability, the more adaptable your nervous system is. So you want higher heart rate variability. So someone who has a higher heart rate variability, their nervous system is more adaptable. They could go through a really stressful experience. So I like the example of, let's say you go to a meeting and you get yelled at by your boss, or you get something happened at work and your boss is really upset with you, and you go into this meeting and you're getting yelled at by your boss. And then you're obviously in a sympathetic mode, your heart's racing and you have more sympathetic tone. You go into this fight or flight, and then you have to leave your meeting and maybe do a presentation to your team and act cool and relaxed. So someone with high heart rate variability could go from this really stressful moment and then leave that stressful moment and be calm and cool and go do a presentation and be fine. Someone with low heart rate variability, whose nervous system is not very adaptable, they'll leave that meeting and they're done for the day. You're done. You can't do anything. You had this sympathetic response that you really can't recover from. So again, this is something that's trainable, and that's a good description of heart rate variability. I also like to think of athletes. Athletes have to have high heart rate variability. So someone like LeBron James dribbling in basketball and running around the court, right? And he's like really in this sympathetic mode, and he's in fight or flight and running around, dribbling, taking his shots. And then if he gets fouled, he has to go to the line, the foul line, calm his nervous system, go more into the parasympathetic, right? And what he usually does, if you see him on the foul line, he takes these long exhalations. So he's trying to slow his heart rate down and trying to get more parasympathetic activity. So someone like a basketball player has to be able to switch in between sympathetic and parasympathetic effortlessly, and that's someone with high heart rate variability. So someone with high heart rate variability is going to be able to effortlessly switch between their sympathetic and parasympathetic branches of their nervous system, and their nervous system is super adaptable. And this makes for someone who is just going to be healthier, right? So a person who has higher heart rate variability will heal better from injuries. They're less likely to have persistent or chronic symptoms. They usually, like the example of going into a stressful meeting and then going on how to do a presentation. Someone like a CEO should have high heart rate variabilities because they have to be able to handle stressful situations and then do presentations where they're acting relaxed and cool. So, like I mentioned before, people use these wearable devices like a Whoop or a Garmin or an Oura Ring. Sometimes I recommend Heart Math or Apple Watches have a heart rate variability measurement. So a lot of these devices measure that, and they could see. So you could basically see which system you're in. And I think it's really cool to be able to measure this, but sometimes people get a little too fixated on it. So I feel like if you have the personality where you're obsessive or it's going to drive you crazy, it may be detrimental to you. What I'm trying to say is because if you get obsessive over these things and you're watching it all the time, all these wearables are good. They're good to have, and they're good to learn about your physiology, and they're good to learn about your nervous system. But you need to take that information and use it for your general health, and don't look at it 100 times a day and be like, why is my HRV down? And I didn't sleep well. I shouldn't work out. So kind of using it more as a general guidelines instead of being obsessed with these. All right, so that brings me to concussion. So working at the hospital for special surgery at their concussion clinic I've learned a lot. Working with these patients who've experienced concussions, we've seen a lot of autonomic nervous system dysregulation. Concussions heal just like any other injuries. Like you have a concussion, usually in 3 to 4 weeks, your nervous system is back down to normal, back down to its normal tone. And sometimes people's symptoms persist longer than normal, just like persistent pain, just like when people have an injury and the pain from that injury lasts well beyond the normal healing times. So normal concussion healing time is about a month, and it is an injury to your nervous system. So it's very common that it causes some autonomic dysregulation. And when heart rate variability is low, the nervous system becomes dysregulated. And we said before, when the nervous system is dysregulated, pain hurts more, dizziness is easier to trigger, brain fog appears due to cognitive fatigue, your sleep is disturbed, visual processing gets delayed, and there are problems with screens and light sensitivity. So even after the concussion's healed, after that, around a month time period, people may still have some of these symptoms, and it is very common for your neurologist or your doctor to recommend some exercises to train the autonomic nervous system, like breathing exercises and certain types of biofeedback. So these self-regulation exercises, they don't just calm you down, they train the autonomic nervous system. They teach you that your brain, they teach your brain that you're safe. So a lot of times I work with people, and when I first ask them, hey, have you ever done any breathing exercises? You ever done any meditation, any body scans, anything that helps regulate your nervous system? And oftentimes people will tell me, well, that doesn't work for me. They don't work for me. But I have to spend a while teaching people that working for them, it's not, these exercises aren't meant to get rid of your symptoms or get rid of your dysregulation or pain or fogginess immediately. It's just like any other exercise. When you start lifting weights, you don't build muscle and get strong after one workout, right? So I like to think of these as a workout. When you do breathing exercises, you have to be consistent. Being consistent with these breathing exercises and doing them 5 days a week, whatever it is, 3 minutes, 5 minutes a day, 10 minutes a day, 20 minutes a day, being consistent, you'll see the results over a period of time. If you're consistently doing breathing and self-regulation exercises and training your autonomic nervous system, you may notice after a month or two that you're sleeping better, that you might have less pain. Things might get on your nerves a little bit less. People who really agitate you might not be that annoying. You might notice that your digestive system is a little bit better. Your urinary system's working a little bit better. You might not have to be running to the bathroom all the time. You might be able to regulate temperature better. You're not always cold or always hot, and you can control that temperature. So think about these self-regulation exercises, or even any type of breathing or self-regulation exercise, as training this nervous system, just like you would be training your muscles when you're lifting weights, or training your cardiorespiratory system when you're running or cycling. Oh, it's just like any other training. The tool that we're going to learn today for self-regulation and to train the autonomic nervous system is called extended exhale breathing. So if you think about heart rate variability, and you think about that sinus arrhythmia that we talked about, that when you breathe in, your heart rate speeds up a little bit, and when you breathe out, your heart rate slows down a little bit. We're trying to bias the exhale. If we exhale for a longer period of time than we inhale, we're biasing our parasympathetic branch of our autonomic nervous system, and we're going to lower the heart rate and lower the blood pressure, and we're going to shift our body into that parasympathetic state. These exercises are very basic and simple, and we start with some nice breathing patterns, but we make sure that the exhale is longer than the inhale. So today we're going to do a pattern that's 4 seconds inhale and 6 seconds exhale. And what that is if you think about it, that's 10 seconds per breath, and it would be 6 breaths per minute. I think my math's right on that. Normal breathing rate for a human is about 14 to 16 breaths a minute. We're slowing our breathing rate down to about 6 breaths a minute. And 6 breaths a minute I like to think of it as it will signal the brain if we're breathing really slow and controlled, then we can't possibly be in danger. Well, let's all take a few minutes. Let's do this if you guys could all join me, we'll do some breathing for about 3 minutes. And I'm going to put a breathing pacer on, and we're all going to follow along. So when you're ready, you could pause this if you want until you get ready, but we're just going to go through 3 minutes when you have time to sit here for 3 minutes and do some breathing exercises. Okay. So let's everyone sit with your feet flat on the floor in a nice upright posture. And you could close your eyes if you feel that's comfortable. And I want everyone just to start breathing nice and slowly. And think about breathing in through your nose and out through your mouth. And then once I set the pacer on, you're going to hear a voice say inhale. And when you inhale, you're going to inhale through your nose. And that's going to be for 4 seconds. And when you exhale, you're going to exhale through your mouth or through your nose for 6 seconds. And we're going to do this for 3 minutes. So let's everyone follow along.
Inhale. Exhale. Inhale. Exhale. Inhale.
So we're breathing in through the nose.
Exhale.
And out through the mouth or nose.
Inhale. Exhale. Inhale.
And as we know that the exhalation is the relaxing breath, so when you exhale, try to relax all the muscles of your shoulders.
Inhale. Exhale. 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 Inhale. exhale, inhale, exhale, finished.
Okay, so now everyone could gradually blink your eyes open. And again, that is a good introduction to starting to train the autonomic nervous system through some very simple breathing exercises. So that was your first, for some people, that's your first self-regulation exercises. Other people maybe regularly meditate or do some other self-regulation exercises or training. There's another exercise that I want to mention, another breathing exercise called the physiologic sigh. So we're not necessarily going to go through it today, but the physiologic sigh is a quicker way to regulate the autonomic nervous system. So extended exhale breathing, which is what we just did with the 4 seconds in, 6 seconds out, that's really meant to have a cumulative effect. So that's meant if you do that every day, a few times a day over the course of a month or 2 months, you start noticing some changes and your your heart rate variability gets better, your autonomic nervous system gets more regulated, and your health improves. The physiologic sigh is more of a breathing technique to get you out of fight or flight or get you out of autonomic distress a little bit quicker. So that you don't necessarily have to do 3 minutes, but maybe you could do 5 breaths or 10 breaths. And the way that it goes is you're going to take one deep exhale in through your nose, and then another quick sip, and then a long exhale through your mouth. So it's going to be inhale through your nose. You get a nice full breath, another quick sip of air through your nose, and then a long exhale. Long exhale. The physiologic sigh, I would recommend doing maybe 5 or 10 of them, where you're going to go full breath in through the nose, another quick sip, and then a long exhale out through the mouth. And again, when you're dysregulated or you feel like you're heading into fight or flight, or you're in a situation where you want to try to shift your nervous system more into the parasympathetic side, this is a good technique to help in the moment. All I have for today. It was really exciting talking about the autonomic nervous system. It's something that I get really excited about and really passionate about. I do use this every day. I work with people with persistent pain, persistent dizziness, persistent symptoms following concussion, and I think it's important for everyone to have some good tools to regulate their nervous system. Thank you.